Welcome to Edds Cosmetic Surgery. Our new clinic facility was built to provide the ultimate in efficiency and safety for our patients. As you enter our center, you will note that all details have been designed with soothing colors and comfortable furnishings. Our patient-friendly staff greets all patients with one goal in mind: your comfort.
I'm Stevie. It's nice to meet you. Welcome to our practice.
You will find our consultation room to be very comfortable and soothing. We believe in giving each patient as much time as they wish to ensure that all questions are answered and that they are totally comfortable with the information they have received. Our skincare section is equipped with the most up-to-date, state-of-the-art laser and skincare systems to treat virtually all areas of concern, including tattoo removal, hair removal, wrinkle removal, brown spot removal, and many other issues. For minor procedures which can be performed under local anesthesia with minimal oral sedation, our fully equipped minor surgery suite is a cost-effective, efficient alternative to using our accredited surgery center. On the day of surgery, our patients are admitted to our holding room where IVs are started, preoperative medications are given, and a certified anesthesia provider evaluates each patient, and we plan and mark for each procedure. Family members are present until patients are taken to the surgery suite. Our state-of-the-art surgery suite is equipped with the same equipment and monitors found in any modern hospital or surgery center. Anesthesia is administered only by certified anesthesia providers. Highly experienced operating room nurses and certified surgical technologists assist with each procedure. Following the completion of the procedure, patients are taken to the recovery room where an experienced nurse monitors them until recovery from anesthesia is complete. Usually within an hour or so after the completion of a procedure, patients are allowed to leave with their family members. As you can see, our facility is designed with the utmost in patient safety and comfort in mind. We think you will understand why we are the busiest cosmetic surgical practice in the tri-state and look forward to working with you to address your concerns. Hello, I'm Dr. Edds, and I want to welcome you to my practice, Edds Cosmetic Surgery. The purpose of this video really is a couple of things. First of all, it's educational. I think it's an opportunity for me to explain a lot of the ins and outs of liposuction to you in a way that in a casual setting you can think about it and think of questions you might have. The second part is basically that it fulfills a legal requirement that surgeons provide to each patient what's called informed consent. Informed consent means that you are explained the risks, the limitations, and the alternatives to any procedure you're thinking about. And so we'll be going through those in the video in a way that I think you'll understand all of those things. The staff gave to you, before you came back to watch the video, a clipboard. And on the clipboard is a sheet of paper. That sheet of paper has, in a sort of a checklist form, all of the items that you'll be hearing me talk about today. And each item has a little dash out to the side of it where you have room to initial. Now, once you've heard me discuss an item and you're satisfied with the explanation or whatever, I want you to initial that. Don't check it, initial it. And that way, then we'll both know that you have heard and understood that specific thing that I've talked about. The other thing that was given to you is a biographical sheet that describes to you my background in terms of education, training, board certifications, academic appointments, hospital privileges, and so forth. So that's just something for you to review, and a little bit further down on the form you'll see a little initial check where you'll check that you've read that and understand my background. The thing that I think is important to understand about this type surgery is it goes along with all the things that I do in my practice. Everything I do is elective. It's not like having a ruptured appendix or a blocked heart artery where you've got to take care of this or you're gonna die. The things that I do, you could either choose to do or not do, and it wouldn't change how long you live or whatever. You might have a better quality of life or feel better about yourself, but everything I do is elective. And so I think because of that, it's imperative that we try to do things in the safest manner possible. There's not much excuse for taking any more risk than we have to for this type surgery. So I think that's very, very important point to understand. Liposuction's been around since the early 1980s. I've been doing liposuction since about 1985. So I've been doing this for over 30 years. It's something that there have been multiple changes in approaches and techniques over time. But at this point, I'm still very comfortable with the type of liposuction we do, and we tend to get very nice results and have had very minimal complications, if any. Been very blessed to not have much in the way of complications over a lot of years of doing it. The ideal patient for liposuction is a patient that has localized areas of fat that really don't respond well to diet and exercise. Not a lot of us are ideal by nature, and so we don't all fit into that sort of definition per se, but that would be an ideal patient for liposuction. The key is to keep a liposuction procedure safe and limit complications is to be, number one, realistic and not be trying to remove more fat than is safe. So we operate on patients for liposuction who have a body mass index of less than 30. You can get online and look at body mass index scales and see where you are, and we'll tell you in a minute because we'll have your weight and your height and we'll calculate that out. In general, I try not to do body contouring or other procedures like that on patients who have a body mass index of greater than 30. Liposuction is not a weight loss procedure. I think that's really important to understand. It's much easier to get weight off with diet than with liposuction. It is a contouring procedure. It's a procedure that takes fat from areas that you don't like, hopefully to improve your shape and your body image. So the maximum safe removal of fat is 5,000 cc's, which is a little less than 1.5 gallons. Now, if you think about 1.5 gallons of fat in a bowl on your kitchen table, well, you know, that's a lot of hamburger meat or whatever if you think about 1.5 gallons. And you think about you're taking that from areas that you don't like, you can see why that would improve contours and improve the way your clothes fit and so forth. But 1.5 gallons of fat only weighs about 6 or 8 pounds. So, you're really not doing a lot to remove weight in patients who really need to lose 20, 30, or 50 pounds. It ends up being, in a lot of patients, a very small percentage of what they need to lose. And so the heavier patients tend to be the least happy with liposuction simply because the percent of improvement is much smaller as far as what they really need to have removed. The anesthesia for liposuction is like most of the procedures that I do. I use a certified anesthesia provider to provide anesthesia for my cases. In addition to that, the areas to be treated with liposuction are injected with what's called a tumescent fluid. And the tumescent fluid has both a numbing medicine in it that causes anesthesia to the area, but it also has adrenaline or epinephrine in it, and that constricts the blood vessels so that it minimizes any blood loss with liposuction. And so in general, there's not a lot of blood loss with liposuction, and patients don't really get terribly anemic or anything with it and do quite well, and that's one reason the recovery seems to be quite quick in most patients. One critical thing, I think, to happiness after liposuction is weight control. And the patients who either maintain their weight or actually use liposuction as kind of a springboard as a reason for them to even try harder to lose a little bit more weight are the patients who are happy. The patients, on the other hand, who are unhappy are the patients who gain weight after liposuction. And unfortunately, in 30 years of doing liposuction, I've seen a lot of each. I've seen a lot of patients come back who've done great and are happy and so forth and maintain their weight. I've seen other patients come back gaining 30 pounds and wonder why their liposuction didn't work. And so there's an issue with that. So I think if you decide to have liposuction, you need to be realistic with yourself about your goals, your expectations, and what in a realistic fashion you think you're going to do with your weight going forward. The process of liposuction is, if you had this done, say, on a Monday, you'd come in, you'd be given some oral sedation, an IV would be started, the anesthesia provider would see you and evaluate you for anesthesia, then you'd be taken back to the operating room where you would be given enough anesthesia to be snoozing, and at that point I do the injection of the tumescent fluid into the areas that are going to have liposuction. After that's in, I give it about 10 minutes to work for the adrenaline or the epinephrine to cause constriction of the blood vessels, and then we start doing liposuction. Liposuction varies in time depending on what we're doing, from 20 minutes to 2 hours, depending on how much we're doing. And that really varies, obviously, with everybody, depending on how much is there. At the end of the procedure, not all of the fluid that's injected, and let me give you an example. I'll inject as much as 1 gallon of fluid into these areas. So there's a lot of that fluid injected into the areas that we're going to do liposuction on. Not all of that fluid is removed with the liposuction. A lot of it leaks out over the next 24 hours, 36 hours, and so it's messy. It's a messy procedure afterwards. It's not such a bad thing, because a lot of that fluid that's leaking out would be there and would be causing more swelling and so forth. But you need to be a little bit careful with your bedding and so forth, not to stain it the night of surgery. So you'll be given a lot of details about that should you decide to have the surgery. But it is a little bit messy for the first 24 hours after the surgery. Basically then, once the procedure's over and you go home, you're waking up through the evening. There's no restriction on activity. In fact, I want you to be up and about. It's really critical that you move a lot, that you try to limit complications that I'll talk to you about in a minute. So I don't want you lying around in bed. I want you up and about. That doesn't mean you need to run any races or be overly active, but at the same time, moving around really helps a lot. After the fluid that's leaking out stops in a day or 2 or 3, then we have most patients wear a compression garment that puts pressure on the areas where there's been liposuction, that helps where all the tunnels are, where there was fat that are removed. It helps those areas collapse down, gets rid of swelling faster, and helps contour the areas out without as much lumpiness and so forth during the recovery period. Usually the recovery from liposuction is such that most patients are able to get back to work in 2 or 3 days or 4 days. So if you had this done on a Wednesday, you'd be back to work no later than Monday, if not a little earlier. You might still be sore, and the soreness is like a muscle soreness, like if you went to the health club and worked out and had some muscle soreness. That's more the soreness you have of liposuction. The recovery and the end result does not come until 3 to 6 months. That's really critical to understand. In other words, if you're thinking about going to Cancun on vacation and you want to have liposuction next week and leave on vacation 3 weeks later, you're not going to have your final result. You're still going to have some swelling from the procedure. There's going to be some fluid in the area. All that fluid absorbs out, but it absorbs out slowly and over a period of time. So usually people have their final result by 6 months. That doesn't mean there's a great deal of change during that last period, last 3 or 4 months or so, but it still changes and it softens up and things contour down. The main thing you do, if you decide to do this, is you watch your weight, you watch your intake, because gaining weight is going to negate any improvement you might have with liposuction, and you could end up actually looking worse. So the patient's tissue elasticity is critical in terms of the final result. So if you remove a volume of fat from the abdomen, for example, then there's a space there. And so you've got to have at least relatively good elasticity of the skin for that to contract in and not have loose, crepey, hangy skin. Now, obviously, the more birthdays you have, the elasticity goes down. So that's a consideration. I've done liposuction on people in their 70s in the past who've done quite well, but they go into it being realistic about what their expectations are. The thing that we'll talk about next are the risk and limitations, side effects of the surgery. So the things that can happen with liposuction that aren't very common usually, that can happen are if there's a little bit more fat removed from one area than another, then there can be a little bit of rippling or dimpling. And so those are things that sometimes require a small touch-up, usually can be done under local anesthesia in the minor surgery room. But those are things that can happen. I don't see a lot of that, but I've been doing it for a long time. And so I try to do a uniform removal of the fat over an area by being, number one, being careful, but also by crisscrossing the tunnels of removal in a way that it tends to even things out. And so I think that's really important. Infection is really rare with liposuction. I don't know in 30 years if I've ever truly had an infection. I might have had a stitch infection or something, but I've never had any tissue infection that I can remember in all the ones I've done over a lot of years. The one complication that I have to mention that is critical, and this is something that's super important, is when you're doing liposuction, there's swelling, obviously. If you do liposuction of the thighs or even the abdomen, it can slow down the blood return from the lower extremities. That sets people up for having some clotting in the deep veins of the calves. If that were to happen, that clot could progress up the veins in the legs. Some could break off and end up going to the lungs, and then it's called a pulmonary embolus. Pulmonary emboli can kill people. And so it's really, really critical that we do everything we can do to prevent either deep vein thrombosis or pulmonary embolus resulting from that. And so there are a couple of things that are important there. Number one, we know that operating on people with a higher BMI than 30 increases the risk of deep vein thrombosis and pulmonary embolus significantly. So that's one thing. The other thing we do is we use compression devices on the calves that during surgery continually massage the calves and keep the blood flowing and keep moving. So that's the other thing we do. But the main thing I think that is really important is early activity. Getting up, getting about. That helps prevent blood clots in the legs. The muscle pump in the leg helps pump that blood out, and you tend not to have those complications. So I can't emphasize enough how important early activity is in the recovery from liposuction. Death from liposuction was something that was reported a fair amount back in the 80s. There were people who were removing far too much fat. There were people who were removing fat without injecting the tumescent solution, and the patients were losing way too much blood. But I do not hear during the last many years, 15 years or so or more, it's very rare to ever hear about a patient having a death from liposuction. And I think as long as you follow the rules and try to keep everything safe and the patient agrees to move a lot, early activity, and you do it safely and with the correct amount of removal, I don't think that's a very high risk, and certainly it's not the 1 in 50,000 that was quoted many years ago. I want to talk to you a little bit about the financial policies. Included in your surgery fee is the facility fee. It's the certified anesthesia provider, the fee that I pay to him. It's all the staff, all the supplies. It's the surgical procedure itself, and it's the follow-up care for whatever number of follow-up visits there are that are normal for a procedure. So all those things are included in the price. In addition, I have here what's called a 2-week global policy. And that 2-week global means that anything that happens to you within 2 weeks that requires a return to surgery, there's no additional charge for. Now, I'd challenge you to find a hospital or another surgery center that does the same thing, because you probably won't ever find one. But I think that's a fair thing to do to patients. But it's a pretty low-risk thing to me, because I don't remember ever taking a patient back to surgery within 2 weeks of liposuction for any reason. If you need a minor touch-up, if you have an area of fat that I didn't quite get low enough, or I didn't get enough out of, I've got a small area that I need to do a little touch-up on, I do that after a few months when I make sure it's not just swelling. I'll do that in the minor surgery room with maybe a little oral sedation and some local anesthesia, and at either a minimal or no charge, at the very most charging for sutures and materials. But that's something I consider more of a minor touch-up. Revision surgery, where there's a lot of extra fat, or there's something I have to do that requires more surgery in the surgery center, basically I would charge my overhead cost and without a surgery fee. There wouldn't be a surgeon fee, but basically I would charge what it would cost me to pay for the anesthesia provider and so forth. Additional surgery that's due to weight gain, I consider new surgery. So if a patient comes back, if I do liposuction and I get what I think is a nice result, and get everything off I think is safe to get off, and they come back in 6 months or a year or 3 years later, and they've gained 15 pounds or 20 pounds or whatever, and they've gotten big again and they want more liposuction, then that just basically is a new procedure. So you'll incur the normal fee for liposuction if that were to happen. We have finance plans that are available for surgery, including liposuction, with payments that can be spread over as long as 5 years. So it can be very affordable payments, and that's depending on having approved credit. And we use a company called Care Credit that's a subsidiary of GE to provide that financing. And so there are applications you can get online for that, or we can give you information about that. We have pamphlets here that describe their program. So at this point, I would like for you to write any questions you have that you are wondering about, or anything I've not answered very well. Write that down in the section on the form, and I'll make sure that when I see you in a few minutes that we get that question answered. So go back through the checklist. If there are not any areas that you have questions about, make sure you've initialed each one of the blanks. And I'll be seeing you in just a few minutes, and we'll talk about this a lot further. So if you'll take your clipboard back out to the staff, they'll place you in the consult room, and I'll be seeing you in just a minute. Thanks.